Hello, and welcome everyone to a very special online event today featuring live case studies on applied somatic healing. I'm Kaylee, and I'm your host here at the Shift Network. I'm really thrilled to be hosting today's program, bringing you Brian Siddhartha Engel, naturopath, doctor of osteopathy, and co-founder of Living Somatics, and Maya Gayatri Anderson Schrieffer, co-founder of Living Somatics and master somatic movement educator. We're very excited to be able to announce a powerful year-long certification with Brian and Maya that blends somatic movement with osteopathy, somatic meditation, and quantum biology to awaken your body's self-healing power. And we'll share more about that later in this event today. So we have a full hour here with Brian and Maya today, and I'd like to go ahead and dive right in. And then at the end of our time together, we'll share how you can make a bigger commitment to your own transformation in this upcoming Applied Somatic Healing Certification, Mastering Somatic Movement with Quantum Biology, Osteopathy, and Somatic Psychology. And we'll leave some time for you to have Q&A with Brian and Maya. Before we get into the workshop, I'd like to introduce Brian and Maya to you briefly. Brian Siddhartha Engel is a licensed doctor of osteopathic medicine and a naturopath. He's a certified HANA somatic educator, somatic yoga teacher, a practitioner of the Feldenkrais method, and an aqua body worker. He's co-founder of Living Somatics along with Maya and the founder and educational director of the Engel Institute for Somatic Education. Maya Gayatri Anderson Schrieffer is the co-founder of Living Somatics and a certified clinical HANA somatic educator, an equine HANA somatic educator, and a graduate of the Novato Institute for Somatic Research and Training. She's also a board member of the International Somatic Movement Education and Therapy Association, ISMETA, and a registered master somatic movement educator. Together with Brian, she co-hosted the first 3 virtual somatic movement summits for the Shift Network. Welcome, Brian and Maya.
Thank you. Pleasure to be here.
Hi, everyone. Wonderful to be here with you.
Okay, and with that, I'm going to hand it over to Brian for an opening and centering practice.
Yes, let's start with just feeling ourselves, getting a sense what's alive for us now in our living body, our soma. As you sit here, just feel your contact with your pelvis or sit bones on the chair, your feet on the floor. Where is your hands connected to yourself or in space? Get a sense of the 3-dimensional you, the length of you, the width of you, and the depth of you. And get a sense also of the space around your skin, the bioelectric fields, which is ever present. Allow yourself to shift into the nervous system where rest and learning and healing takes place. Allow a settling down in the system. Stay with the sense of wholeness as you allow this shift to happen. And if you can bring your attention to your spine, and then let your attention float forward to the front of your spine. and get a sense of how everything is organized around this primary midline. Invite a deeper stillness to emerge from the front of the spine, your somatic home. And notice how everything is organized around this midline. Allow a stillness to emerge around the midline. And at the same time, get a sense of the rest of you, including the bioelectric field, in relation to the midline. What emerges goes laterally and forward and backwards from the midline into your bioelectric field. Deeper shift to stillness. Notice the easy breath through the nose. And at the end of the out-breath, you may ask the question, where is the health? And let your system give the answer. What is the sensation that you know you're alive right now? At the end of the out-breath, where is the health? And just wait and let the sensation of your living soma give you the answer. The health is the same inherent forces that grew you and now heals you. The health is always present, even in a disease process. We invite the health to continue its work in self-organization and self-healing. Now, throughout this hour, and until you take your last breath. Let that self-organizing, inherent healing, organizing, balancing continue as you slowly open your eyes and come back to the room. And just notice that you may feel in a more settled space, more stillness may be available for you. Get a sense of what it's like to invoke the health in your system.
Wow, thank you, Brian. I somehow feel more still and centered, but also more vibrant and alive and out. So thank you. That was beautiful. And before we go ahead and dive into the case studies, would you mind just briefly speaking to us about your really unique approach to somatic healing and why you feel it's so important to take a holistic approach to healing?
Well, we all know that a holistic approach to healing is probably the better way forward. Many people in the healing game tend to focus on their speciality, whether it be movement, whether it be psychology, whether it be the environment, whether it be herbs or medication. From an osteopathic perspective, we are very much interested in finding the health, as we have inquired there, and allowing the health to move and help the disease process find deeper healing. And in fact, the disease process, in my opinion, is part of the healing process. So my holistic vision incorporates working with the physical body, working with the energetic body, the bioelectric field, working with the environmental factors using quantum biology and circadian biology, and also looking at the psyche and possibly the psychic root or cause of a disease. In fact, in osteopathic medicine, we are very much into finding the root cause of the problem, because if we don't address the cause, then we can't really address the problem. So by trying to figure out what is the root, as we say in osteopathic language, lesion, whether it be physical, whether it be psychological, whether it be social, whether it be environmental, whether it be energetic, or indeed spiritual. And when I say spiritual, I mean, have you found the purpose in your life, the calling in your life? What is the function of your one and precious life to contribute to this world, to leave it in a better place? And if we haven't really found our calling in that regard, that too could be a cause, a root cause of our ailments. So in the course that we're offering here, actually, we want to delve into all of these aspects in relation to all the things I've just described, especially actually somatic movement, and to be competent in understanding how we can apply these different aspects to find the health and to accelerate self-healing and really become, I'd like to say, medical freedom, where we become so confident in our own system and in our ability to self-correct without leaning into medication or even herbs for that matter, because the pharmacopoeia within ourselves is the most accurate and is the most wonderful. And if only we could understand that a little bit more and trust that a little bit more and create conditions a little bit more for the health to show itself by removing the obstacles to the health. So that's my holistic vision that I live and that I walk my talk, and it's what I want to share with you today and in future.
Great. Thank you, Brian. And let's go ahead and dive into the case studies now, starting with the one on knee pain.
Yes. So this was an elderly gentleman who he had knee pain, and he went to get x-rays, and he had what's called chondromalacia patella, which is wear and tear in the front of the kneecap. And, we looked at the way he was walking. We asked him questions about his lifestyle and so forth. And he really wasn't spending much time outside at all in the sun or really doing that much movement. In fact, he was just sort of like sitting a lot. And his walking pattern, his pelvis was very, very fixed. And he was just sort of holding a lot through his legs without he was protecting something that he didn't have to protect anymore. So we worked with a somatic walking lesson, which is breaking down the walking pattern so that we can use our whole system and our pelvis a lot more when we walk. And we're not just relying on our legs, but relying on using the whole system for working. We also worked with possibly when we get a little bit older, we can look at the psychological component. And in this case, it's a self-devaluation component in relation to performance. And you notice that athletes, as they're getting on in their career, they'll often get knee pain because these other younger athletes are coming up and they don't feel that they're performing well enough. So if we can address the root psychological cause of knee pain, then to ask those questions and reassure the subconscious mind that this actually isn't the case, then that can be quite useful. And of course, the grounding is a big part of my work. A very simple thing is to just get your feet on the ground, because the free electrons that come from the Schumann's resonance enable this healing to take place too, because a lot of what we need in our system is in relation to free electrons, and the earth gives us free electrons as well as sunlight. In fact, the earth and the sun gives us 2/3 of our nutrition, while food only gives us 1/3 of it. And if we're not getting the earth and we're not getting the sun, then we're going to tend to overeat because we're not fulfilling our need for electrons. Our system will think, oh, I need more food, I need more food. But actually, what you need is more sunlight, and you need to have more grounding. So after applying these different approaches in relation to the walking lesson, in relation to the psychological component, in relation to sunlight and grounding, there was a lot more comfort in his knee, and the pain was reduced significantly. And in fact, his walking improved quite a lot as well. So we looked at all aspects, we prescribed the treatment plan from a holistic point of view, and we had an outcome.
Right. And moving on, Maya, if you would like to present this one, please.
Yep. So, one of the cases that I would like to share is a woman who suffered from severe reoccurring anxiety. And it was a really successful case, and it really touched me because this was an example of an individual who was really suffering lifelong, being very uncomfortable in life in a lot of scenarios. And so she learned through cultivating more that sense of being at home in her own body. So cultivating a somatic self, cultivating a sense of somatic self-connection, which was probably the biggest takeaway from her, that she could just feel at home in her own body. And we did that by focusing on developing a self-practice of somatic movements. And so guiding her, and then she cultivated that ability on her own. We also worked with a practice of circadian biology. So she would do grounding. She would be more in the sun. And we were also looking at some practices that she could do before going to bed. So that really paid off. So already after a few sessions, she could already have a sense of that more ease and settlement in her body. She was feeling more settled. And this was the sensations that she had wished to experience her entire life. And so she learned how to regulate herself, especially then when the sensations or emotions that came up felt overwhelming based on childhood trauma or other things. And she learned how to manage that initial discomfort so that she could reestablish a healthy baseline where she felt empowered to navigate her own state and her life. And so she felt increasingly safe in her own body. She felt more embodied. So what happened was that she was able to sort of look at the past traumas more and more. They were not having a grip on her in the way they had in the past. And so that gave her more and more confidence. So she started to also cultivate healthier boundaries. And she, with her skillfulness and feeling empowered, the way she managed her anxiety and her emotions and her circumstances, she became a beacon of light and hope and inspiration to her whole family. And so that was very impactful for me to work with her. So I thought that that was one good example to see how this kind of work can change someone's entire outlook on life. And Siddhartha, I think you can do the next one then.
Yes. This was a middle-aged lady. She was a Muslim. She is a Muslim. So she spent a lot of the time covered up and covering her head and most of her body. So most Muslim women who have that garb don't spend a lot of time in the sunlight. And she had general joint pains, and she was diagnosed with rheumatoid arthritis, and also she was on depression medication for 20 years. So we worked with her hands-on, and a lot of the hands-on session was going through similar technique that I introduced you to in the beginning of this grounding centering practice. It was enabling her to find the health in the system. And, I would just touch her feet or touch her head, and I would wait and I would listen for the health to emerge through the midline and just follow the inherent treatment plan of the system. So we worked with her a few times in that way. And all the while, we were coaching her in a similar way that I coached you in terms of this osteopathic mantra. Where is the health? We coached her around circadian biology in relation to if she could find a place to take off her clothes and be with the sun and to watch the sunrise and to watch the sunset, and also to get out of artificial light in the evening. So the light is one part, but the dark is another part, so that we can have proper and deep sleep. And I would say, I think also I recommended that she stopped, yes, I did, eating after sunset. And that was a major component in her case. And also, I was in Morocco at the time, and Morocco, if you didn't know, that bread and wheat is a huge part of the stable diet there. So I advised her to completely cut out wheat, which she didn't entirely, but she did largely. So reduction in sugars and carbohydrates, not snacking in between meals, et cetera, et cetera. So all of these approaches enabled her to come into better sleep. There was significantly pain reduction in her joints. She felt better about herself. She had more confidence. She had better mood, and she had a better outlook to life. She improved in her mental health and her outlook and her general health. So I feel that her happy state came up and her depressed state came down. She became more optimistic, and she had more ease in her system and enabling to access the health. And I gave her that osteopathic mantra to do just before she slept. So before she sleeps, she just asked that question, where's the health? The end of the out breath. Let the system show her where the health is, and that the health would be working with her throughout the whole night. So the inherent treatment plan was at work throughout the whole night by accessing the subconscious mind by asking this question. So that was that case.
Thank you. And now we'll go back to Maya.
Yep. So this was a woman who came to me when she had acute lower back pain. And so it was sort of chronic over time, but at this very time it was acute. And she had a high-powered job, so she could not sit down. She had to work standing up, which was very inconvenient. And so we worked with finding ways for her to slow down a little bit to feel herself. And that had more to do with some kind of somatic attunement rather than the pace of her life. So it was about finding pockets where she could apply somatic awareness in her everyday life. And in addition to this increasing somatic inquiry, she also had a self-practice of movements. So I saw her for a total of 5 sessions. And during that time, though, I think it was over like a month and a half. And in that time, she became entirely pain-free. She had a toolkit that she could work with on her own. One of the things that we focused on was working with support. So working with both physical support, internal, external, and also emotional support, which is one of the things one can work with when it comes to lower back pain. So internal support, like how is your skeleton supporting you? How was the spine and the pelvis holding her up? Working with leaning into the support of the chair or the wall or the backrest, and then looking at other types of support. So support was one big theme. And also looked at how she could be by the ocean and receive sunlight onto her body. And it all circled back into a deeper sense of knowing how to self-care. So whether it was micro self-care moments, or it was the movement practice, or it was simply starting to make more somatically informed decisions in her life, which then had a self-care result. So one of the outcomes was beyond moving from pain and discomfort into ease and comfort, so resolving the back pain, also ongoing tools for self-management. So she knew how to, if the back would act up again, she knew how to manage that. But she also had improvements in her close relationships because she became more somatically informed. So her close relationships were enhanced by that sense of being more present and being more resourced. She was able to be with her loved ones in a different way, which was very fulfilling to her. Yeah, so I think that was it.
Yes, and before we move into questions, Brian, I'm wondering if you could speak for a moment about how or if insomnia plays a role in all of these cases and in healing.
Yes, insomnia is a thing in this day and age, and it's a very important aspect to be addressed, because if we're not enabling deep sleep to happen, then the self-correcting mechanism and the organizing cleanup mechanism that happens during sleep won't do what it has to do, which is a big detrimental effect on mitochondrial function, which is a big problem when mitochondrial function goes down. So the strategies that we have to work with insomnia, first of all, to understand that the system has a reason for doing what it's doing. And if the person is waking up early in the morning and not being able to go back to sleep, it's usually because there's an active conflict that's taking place and they need more time to resolve that conflict. So to outline that is maybe the issue here with the insomnia. What is it that you're thinking about? What is it that you haven't cleared up in your life? And to give some strategies to help solve that conflict, whether it be working with the subconscious mind and addressing the subconscious mind to get to the root cause there, or something that has to happen in the external world in terms of some change. So that'd be the first strategy that I would use, is to look at what is the conflict and why the person is waking up early. The second thing that I would look at is the light and dark scenario. Are they watching the sunrise to set their suprachiasmatic nucleus, the master clock, which sets all the other cellular clocks? So that's an important aspect. Also, the grounding, to be in touch with the earth where you are, also sets the circadian rhythms, and also the timing of eating. And if I had one piece of advice around that, or let's say two pieces of advice around that, or say three, it would be: don't eat after sunset or 4 hours before you sleep. Don't snack between meals, and only eat when you're hungry, and focusing having a bigger breakfast and a lighter evening meal. And if you can and you're comfortable, possibly 2 meals a day without snacking in between. So looking at, and also then cutting out artificial light in the evening, so the melatonin can really kick in at the right time, and deep sleep and deep cleanup can take place. So looking at the light environment, making sure it's pitch black when you are asleep, making sure there's no eating after sunset or 4 hours before you sleep, no snacking between meals, feet on the earth. And resolving the conflict. If you look at all these aspects, then you can surely find out the root cause here and restore deep, deep, long sleep. That's how I generally approach it.
Thank you, Brian, and thank you, Maya, for presenting these cases. So now I'd like to go ahead and move us into the Q&A portion. So if you have any questions, you're welcome to raise your Zoom hand, preferably not your real hand, so we make sure we see you. And then you can also submit your written questions through the chat. And I would ask that you send those to me, your host, and we'll go ahead and moderate the Q&A that way. So I'm going to kick us off with a question we already received. How do you typically approach working with a client who's received a diagnosis from a Western doctor? Would you integrate or consider their medical treatment plan in your sessions? And how would you tailor your work to support their healing journey in that context?
Well, I would always respect the working relationship with the client and their doctor. The question is, why are they coming to see me if they're, getting prescribed something and they're working with somebody else? Clearly, something isn't working. So we respect the medical diagnosis, but we also look from a somatic point of view and a quantum biology point of view and a somatic psychology point of view. So we try to address the root cause. And we try to, the role of a doctor actually is more, that's what it means, is more of an educator. So my goal would be to educate my client and how they can make changes for themselves and how they can come back into trust in the health in their own system and the self-correcting mechanism in their own system, and to rely on their innate pharmacopoeia that they have inside that's always working very well. So teaching them how, as I said earlier, to remove the obstacles to the health and come back to health. But N equals 1. Everybody is a unique person with a unique situation. So we have to look at all the factors and all the components. And sometimes, prescribed medication is the way to go and surgery is the way to go. But a lot of the time that is not necessary. So if we can avoid that and find another way, then that's definitely what we'll do. And that involves finding our ability to self-correct and heal rather than relying on somebody else or some drug or some herb. That's how I would approach that.
Thank you. And now we'll go to Carrie. You can unmute and ask your question.
Hello, Brian. Thank you so much for the information you gave regarding insomnia. That's just one of my problems. But as you were talking, it was really coming to me that has really exasperated a lot of my problems. And the main reason I'm not sleeping very well is because I unfortunately broke my right knee completely in half 3 years ago, and it's full of metal now, which restricts movement. So it's trying to get physically comfortable in bed because I'm that knee is stiff, and and you try and turn around, and also I do get acid reflux, so I'm like sleeping on an inclined pillow. So I can understand the food thing. I do all that, what you said about the food. I don't eat after 6 p.m. normally, and I only have 2 meals a day, and it's all health foods. Don't snack in between meals, all that. So it's just like, how do I get a position that's gonna help me sleep? Right. And another part about the question is that you're saying to go to bed as soon as it gets dark. Well, that's not quite doable, really. A lot of the time when we're in the UK and it's like dark at 4 p.m. Are you saying this is just a small time that we just do that, going to bed at that early time?
No, I wasn't saying going to bed. I wasn't saying going to bed when it gets dark. I was saying don't eat after the sun sets. But in the winter time, the whole idea is that you should really get into hibernation mode and go to bed much, much earlier and sleep longer. In relation to I understand that you're having some problems there with pain in your knee in relation to that fracture and the metal in your knee, and also your reflux esophagitis, and you have to sort of sit partially sitting up, lie partially sitting up. So my advice would be I know you're living in the UK, you don't get a lot of sun there, but get in the light as much as you possibly can and get your feet on the earth as much as you can, because sunlight is actually a painkiller. And the grounding of the earth actually takes down inflammation, and also it will help with your sleep. So I'm suggesting that maybe you're missing the outdoor life and the feet on the ground and the light in your skin, and that might be the key issue for you in relation to your sleep.
Thank you. Thank you.
Sure.
Thank you, Carrie. And I'm going to read one question from the chat, and then we'll go to Chandra after that. How do you work with chronic illness such as cancer?
Yes, cancer is a big issue now. And again, I would look at it from all angles. I would look at what is the possible psychological conflict in relation to why the system came out with that cancer. And is that cancer, and in fact, a healing crisis, and that we can just trust in that process? Maybe the surgery is needed because it's gone too far and it's life-threatening. Is it something to do with mitochondrial health, which is to do with the circadian biology and the quantum biology? Is it something to do with blue light and being in front of Wi-Fi or phone, blue light from screens, et cetera, et cetera? Is it because, you know, we're not following circadian rhythms and eating late at night and all these things? So again, looking at all of these factors and trying to find the key lesion as to why has this taken place, and is it indeed the system going through a healing crisis, and we can trust in that process and allow it, support that process and allow it to go through what it needs to go through. But I'll give you some advice about how to create a healthy lifestyle, but certainly I wouldn't be advertising that you're treating cancer, but you take place, and hopefully that you can go through the cancer process without it actually affecting the lifespan. And actually, to be honest with you, the reason why I got into this work, even though I've been an osteopath and naturopath for so long, I really upped my game in the last few years, because so many people I know have been diagnosed with cancer, especially in recent years, and turbo cancers. So I started really going like, what is going on? Why is this happening? And I went deep down that rabbit hole, and I've got a lot more to say about it than I just did, but thank you for the question.
Yeah, and I can just add also that we can also address the secondary complications, like the emotional component, for example. We can also look at how do we prevent getting cancer by being more embodied, being more somatically attuned, applying the circadian biology, so on. We can also look at if someone has gone through treatment, or maybe someone has had an operation or a surgery. Like, there are things that we can do with this work that's very gentle and very well suited for that rehabilitation process.
Thank you. And several people are writing in with just similar questions along that same vein, like your approaches, would it be the same approach for kind of all of these chronic illnesses and diseases that pop up? We've had people naming things like diabetes and Parkinson's and some other more specific things. So if you could just kind of speak to that.
Well, first of all, I always believe that the disease process is part of the healing process. So a big part of my work is to educate the person to trust in the self-correcting mechanism that we innately have. The system is highly intelligent and does not make any mistakes. So if the client can realize that often a lot of the symptoms they have are part of the healing process. And the problem is, in fact, is that we tend to trigger these healing crises and these tracks, and we tend not to get to the root cause, so it doesn't really get a chance to complete itself. And also what tends to happen is that we tend to just try to suppress symptoms, at least that's the allopathic model, rather than looking at cause and treating the psyche and the soul, as Plato called it, the medicine for the free. What's happened in today's age is that we just have symptoms and we have some intervention to reduce the symptoms but not address cause. Everybody's an individual, of course, But what we need to do is look at the cause, look at the conflict, the psychological cause, look at the environmental factors, look at the circadian rhythms, look at the person, look at their ambitions in life, look at their fulfilling their ambitions, look at them from a spiritual point of view, and to really find, as we say in the osteopathic world, the key lesion. What is the key issue here that is causing this problem? Is it physical? Is it psychological? Is it social? Is it energetic? Is it emotional? Or is it spiritual? So one needs to do a comprehensive case history, find out what the key lesion is, and then have a strategy to address that key lesion so that the healing process and the healing crisis can go through what it needs to go through, so it won't have to repeat itself in the way that it seems to in this day and age. So that's my answer to that question. Unless Gatri's got something to add.
No, I think that was a very full answer. Just there was Parkinson mentioned, and as that is a neurological condition, we can remember that our living somatic movements are based on neuromuscular work. So that's a neuromuscular re-education. So that can very much be helped. Or the symptoms can be lessened by learning how to regulate somatically, and so that tremors will lessen and other things can be helped with that. So there are a lot of things we can do by just strengthening the self-healing capacity, and also our trust in ourselves, that we know how to regulate ourselves, we know how to heal ourselves. And that trust yields a lot of positive results. I want to hear what Chandra has to say.
Yes, Chandra, you're welcome to unmute now. Thank you for your patience.
So I've already received so much from both of you that feels very helpful with my particular question, but I wondered if I could get a little more specific with you with shoulder.
Can you speak closer to your mic? Chandra, I can barely hear you.
Can you hear me now better?
Yeah, a little. Yeah, thank you.
Is that better? I could put it on headphones. That can help. Is this good enough?
Yeah, that's fine.
Okay. So shoulders, and I'll say that just briefly, a couple of years ago, I started having really a lot of shoulder on my right shoulder issues, and I did an MRI, went to physical therapy, rotator cuff tear, labrum tear. They were recommending surgery, but I went natural route and a lot of somatic. I have a lot of somatic practice, and I'm a dancer, so I have a lot of connection with my body, and I was able to heal my right shoulder. So then soon after that, my left shoulder started acting up, and I went through diagnosis of shoulder impingement, shoulder subluxation, and now I'm going to have an MRI to find out for sure. But my PT says frozen shoulder. And what struck me was, Brian, when you were mentioning internal family, how the internal family system can really come into play. Because these last few years, there's been a lot of loss in my family, and showing up for a lot of caregiving. And I can feel that I've been carrying a lot, and I'm just wondering if there's anything you can.
Well, absolutely. There's some
frozen shoulder. And what I'm told is that frozen shoulder is insidious. They don't even know, they don't quite know even why it happened. But I'm losing a lot of muscle. I'm losing my muscles are atrophying. So now I'm trying to do exercises.
Let's look at the root cause here. Who is it in your life that you want to push away, that you can't push away? Or who is it in your life that you want to embrace, that you can't embrace?
Well, push away what comes up immediately is my sister, and embrace is myself.
Okay. So you could start with your sister, first of all, and I'm just going to make this really brief because we haven't got a lot of time here. Just one question I
Those
want to ask.
questions are pretty good.
So just one question I want to ask you. Do you feel that she's hurt you or that you've hurt her?
Both.
Okay. So here's what I'm going to suggest that you do to resolve this issue with your sister. You invoke the pure soul in her and you ask for forgiveness in the exact ways that you've hurt her, and you ask for the energies never to do it again. And then you invoke the pure soul in her and you ask for forgiveness that she had to be the one to hurt you in the way that she hurt you. And you ask for forgiveness. And you spend 10 minutes on this every day. And then before you sleep, you say, dear subconscious mind, I've resolved the issue with my sister. I've done these forgiveness techniques. There's no need for you now to have this shoulder pain running me anymore. You can turn it off. So that is my suggestion. And when if you can't remember what I said, you'll get this recording and you can come back to it.
I recorded it too, so thank you so
Okay,
much.
fine.
Thank you.
Thank you. Thank you, Chandra. And we'll go ahead. There's a couple more questions in the chat, and I see Bella's hand as well. So we have some people who are wondering if they have exceptions. So they have to have a lack of sleep and circadian rhythm because they're a mother to an infant, or someone who lives in an urban environment and feels like they can't access the earth. How do you work with people with circumstances like this?
You do the best you can with what you got. There's always something that you can do. You can always stop eating 4 hours before you sleep. You can always take a nap in the middle of the day if you're being woken up somehow, some way. You can always try to have less artificial light in the evening. You can turn your Wi-Fi off at night. I'm not telling you what to do. I'm giving you information. And then you've got to do any little bit that you can to see if there is a change in your symptoms and it makes sense to you. And if it does make sense, then you do a little bit more, and then you do a little bit more, and then you're completely convinced. So don't believe what I'm saying. Listen to what I'm saying. Do your own research. Apply what I'm saying. See the results. But a small thing can go a long way. You don't have to do all of it. And in that circumstance, you can't. But I remember when I was working in Delhi there last year, I would, near the airport, I would go for a 15-minute walk and find a patch of grass and watch the sunrise. And that's how I started my day. So there's always a way to do a little bit.
Yeah, and it's also not only about what we can do externally, it's about how can we regulate ourselves internally. So especially when life feels too much, that's when the somatic skill of self-regulation is essential. So that is what you're going to learn in this 1-year program. And by learning it yourself, you also know how to teach someone else to do that. And if you already know it, you're going to become even better at it. So it's both the external and the internal together.
Lovely, thank you. So Bella, I would love to hear from you now, if you'd like to unmute.
Super, I really appreciate that. Can you hear me well?
Yes, we can, Bella.
So I'm being brave, I guess. I might cry. I'm gonna be having double hip surgery, and I've been preparing for a while now. Physically, emotional, spiritually. I also have a yoga therapist that has agreed to support me, and she does some somatic work. The thing that I'm finding the most, I guess, a little bit challenging or is preparing in the way, like, I know I have rheumatoid arthritis, and I'm gonna have to go off my medications, and some of the supplements that I'm taking currently are already myself on my own, like, weaned off like some supplements so that then it's less of a shock to the body. I've also just recently started listening to some specific, I'm going to say, meditation music to prepare for surgery that's was recorded back in 1992, and I can't remember her name right now, but she's really great. So
I think you're frozen up there, Bella.
Let me address what you've said already while you're frozen, Bella. I don't know if you're unfrozen, you can just start speaking immediately and we can continue the conversation. And if you're not getting this, you'll come back to the recording. So first of all, I would definitely say the more that you can get near infrared light on your pelvis and on your hips before the surgery, the better. And if that means actually, if you're in an urban situation and you're not able to, and there's not much sun because you're in the winter, I don't usually recommend this, but red light therapy would be something that I would definitely recommend, and also grounding. These two things will help you a lot. And I don't know where your surgeon is at, but if he could have a red light lamp on during the surgery, that would be highly beneficial for the healing to take place and to accelerate that healing and the recovery after the surgery. And also, are you still with us, Bella? Are you still frozen?
Yeah, she's back.
Are you listening to what I'm saying, Bella?
yes, I
she
am.
is.
My internet went down, but then I was able to reconnect. So thank you.
Great. So I was just talking about red light therapy and grounding, and those two things are very important. And just looking at the psychology of the situation, is there somewhere that you've lost your seat and you can't sit? Somewhere that you need to sit at your desk? For me, it would be on my motorbike, or for somebody else, it might be on somebody's lap. You might want to look at where is the place that you've lost your seat.
Oh,
And
that I lost my seat. Okay, I wasn't cluing into what you were saying.
yes.
So can you just, I guess, expand on that a little bit so that I guess my brain understands a little bit better?
Yeah, for me, it would be like if my motorbikes got taken away and I couldn't sit on my motorbikes. For a teenager girl, it might be not being able to sit on the boy that she has a crush on's lap, and she'll have hip pain. Or somebody else, it could be they've lost their seat at their desk. Is there somewhere in your life that you've lost your seat?
Yeah, I'll have to think about that, but I'm still, I guess my brain is not computing 100% of what you're saying, but it's okay.
It's
Sure,
okay, yeah. And
So,
also you can look at, after the hip surgery, you can look at how to use gentle somatic movements to recover faster and to deal with the secondary impact through the hips and waist and back and so on while you're recovering. So there's a lot you can do before and after with that as well.
yeah, I'm doing right now. I have a myofascial release therapist, and now she started saying that my hips and my pelvis have started to like move, you
Okay,
know?
so you can do that for yourself
Yes,
by doing movements that are gentle. Yeah,
yes, yeah, I do that pretty much every day. I just once in a while I just take a break. I go, okay, today is a break
amazing.
day. But
Okay.
I'll listen to that again and try, like maybe ask the question before I go to sleep or during the day, like what you're suggesting, Brian, where I've lost my seat.
Yeah,
Maybe.
and also before you sleep, you can ask that question, where is the health? And let
Yeah.
the health do its work. And before the surgery, if you're under, you could ask that question, where's the health? And let the health do its work.
Okay, super. Thank you.
Sure.
Thank you, Bella.
Thank you, everyone. We've had so many great questions today. And now I want to be sure that we have time to talk about our upcoming year-long certification program. So we're really excited and just truly honored to be hosting Brian as our lead faculty and Maya as our integration faculty for the Applied Somatic Healing certification. As you can tell, they've both done the work and are truly embodied. And I'm going to drop the link in the chat here. You can type the URL in as well. It's appliedsomatic.healing.com. appliedsomatic.healing.com if you want to follow along. And now I'm just going to share a little bit of the details for the program. The year-long program begins on March 18th, 2025, with weekly sessions with Brian on Tuesdays at 8 a.m. Pacific for 120 minutes. We'll have integration sessions with Maya 3 to 4 times per unit at 9 a.m. Pacific on Thursdays. We'll have regular facilitated pod meetings, and these, I'm really excited about this component too. They're led by highly trained facilitators who are already graduates of Living Somatics, and they've studied extensively with Brian and Maya. So you'll have the opportunity to meet with the same pod throughout the whole program at a time that works well with your schedule and your time zone. And in these meetings, you'll have the opportunity to receive ongoing personalized feedback in this really nice small group environment. We'll have 4 guest faculty workshops taking place on Thursdays throughout the year. And the entire training program, when paid in full, is $5,000, which is a great value for such a comprehensive teacher training program. And if you prefer, we do have a couple of different payment plan options as well as partial scholarships, which do require separate application. You'll see all of these details are laid out at appliedsomatic.healing.com. And we are offering a $500 discount. So if you register before tomorrow, January 15th, it'll bring your total down to just $4,500. And you'll see on the page that if you have further questions, you can set up a time to have a free information session. I'm hosting these, and we have select sessions where Brian and or Maya are joining as well. So you'll get an opportunity to speak face-to-face to one or all 3 of us, and we can answer all your questions about the program there. And again, you can register these through the appliedsomatic.healing.com URL as well. You'll see them called info sessions. And because of the rigor and intimacy of the program, we are going to limit the number of students so we can ensure there's personal attention and maximum impact. So if you decide you want to join this amazing opportunity, you will first undergo an application process. To get this started, you would again go to appliedsomatic.healing.com. So I encourage you to give it a read, tune in, see if you're getting a yes for the program, and then we really invite you and encourage you to submit your application. I am the program manager for this program. I've been working extensively with Brian and Maya for the past few months to develop it, and I am just really inspired and truly believe in their work. So I'm extremely excited for this program. I hope you're feeling that excitement too. And we would really love to have you apply to join us. So if you're feeling called, please do visit the URL one more time. It's appliedsomatic.healing.com. And I just want to take a moment here to thank all of you for joining us for this hour, and to really thank Brian and Maya for sharing so much wisdom and insights with us today. I'm incredibly excited for this year-long journey with you and for everyone who joins us as participants. And I just want to pass it back over to see Brian and Maya, if either of you have any final words for us.
Well, pleasure to be with you. Thank you for showing up. And if you decide to join us, it would be our honor and pleasure to be your guide and teacher on this year-long journey.
Yes, and if you have more questions for us, do join one of the Q&As so that we can chat with you more privately or personally in a kind of smaller group. And just know that this 1 year, your program is really designed for you to excel in any way that you wish to. And it would be our joy to support you in that journey, so that you gain tools, not just for yourself, but also to help others. So that is our passion in life, is to spread somatic movement wide and far in the world. So that is why it's our joy and pleasure to be here in collaboration with the Shift Network. So thank you all for joining, and hope to see you soon again.
Thank you so much, everyone. Thanks again, Brian and Maya. And we hope to see you in the upcoming program. So feel free to visit the page appliedsomatic.healing.com. It's also in the chat for you. And there's tons of details there and the signups, like Maya said, for the info sessions. We'd love to visit with you in a smaller group as well. So thanks again, everyone, for joining us. And I hope you have a wonderful rest of your day.